On coronavirus, most adult Americans may soon be eligible for a second COVID booster shot. The Biden administration says it is considering whether to expand the second shot to adults under 50 years of age. Now, it's an effort to counter the latest highly contagious BA.5 variant of COVID, which has driven up hospitalizations. The move would require regulatory approval. Officials from the FDA and the CDC are expected to hold discussions in the coming days. And we're joined this afternoon now by Dr. Bill Hartman from UW Health. And we'll start, Doctor, by asking the question about those booster doses for everyone. How much more protection does that extra booster offer? And what do you say to the people who got their first two doses, but for whatever reasons haven't even gotten that first booster?
Well, getting that, at least that first booster, and then subsequently now that the second booster is very important. These vaccines continue to provide really broad protection against the worst things that can happen from COVID: severe disease, hospitalization, and death. These vaccines protect very good against that. And with the BA.5 variant being so highly contagious and being able to infect both people that have been vaccinated previously or individuals who've even had COVID, the ability to protect you against these bad things that can happen from COVID is very, very important to keep people out of hospitals, to keep people as healthy as we can. And so these booster doses, which have been available to people over the age of 50, really need to be made available to everybody so that everyone can have this protection.
I want to touch on vaccines for kids 5 and under. The numbers show that parents are kind of hesitant to get their young kids vaccinated. Is that kind of what's putting us in this cycle, or at least part of it, of going into these waves of COVID?
Well, the more people that we can get vaccinated, obviously, the better we can get COVID under control. The ability of, especially since Omicron, the virus to mutate to forms that can evade different types of immunity has been accelerated. It seems to be able to change itself very quickly. And so obviously, the more people we can get vaccinated, which includes the under 5 crowd, the 18 million kids nationwide under 5, it's very important that we get them protected, that we protect our communities, and try to keep these waves from occurring.
There are some people that are, catching COVID for the second time here. And does that increase the chances of long haul COVID and health problems?
Recent evidence indicates that it can increase the chance. Each subsequent time that you get COVID, you have an increased chance of getting something wrong with your heart or your lung or your nerves, something that contributes to long COVID. Now, the vast majority of people who get COVID multiple times probably will do okay, but we have to be cognizant of the fact that repeated infections is not a good thing. And every time you get sick with COVID, your chance of developing long COVID is there.
So the CDC is saying about half of these new cases are this BA.5 variant. What do we know about the variant? Obviously, you said it kind of evades immunity a little bit there. Do you think that they're going to make the vaccines now to be more potent against this particular variant, or is it always constantly changing? They can't keep up with it.
Well, the vaccines we have are still doing the job that we hope that they would do, protecting against severe disease, hospitalization, and death. The FDA and CDC have asked Moderna and Pfizer to create a bivalent vaccine that does have the ability to attack the BA.4 and BA.5 variants. We have to test that to see if that's actually the right way to go. Hopefully, we can figure out the right way to get the most people protected and to keep the most people from getting sick.
All right, Dr. Bill Hartman with UW Health, thanks so much for being with us this afternoon. We appreciate it.